Thank you, Senator Glazer and other members of this committee. My name is Christina Hildebrand. I am the founder and president of a Voice for Choice advocacy representing over 30,000 physicians, nurses, and other professionals, as well as concerned parents of California. We advocate for people's rights to be fully informed about the composition, quality, and short and long-term health effects of all products that go into people's bodies. I ask today that we not forget history, but instead that we learn from it. In 1976, President Ford implemented the National Swine Flu Immunization Program in response to a possible novel H1N1 influenza pandemic. This resulted in a vaccine being developed in 6 months based on an existing flu vaccine and was authorized for emergency use. However, vaccine manufacturers would not release it without removal of liability, which was granted in September 1976. 40 million people in the U.S. received this vaccine in less than 3 months. A significant number developed Guillain-Barré syndrome, which led to the suspension of the vaccine in December 1976. In 2009, there again was a rush to get another H1N1 vaccine on the market due to fears of another global swine flu pandemic. GlaxoSmithKline's vaccine was approved by use by the European Commission without clinical trials being fully completed. The UK government agreed to indemnify GSK. This vaccine was administered to 6 million in the UK, and for 1 in every 50,000, the vaccine caused the immune system to attack clusters of neurons, causing brain damage, leading to permanent narcolepsy. So here we are in 2020 with President Trump's Operation Warp Speed, hurling COVID-19 vaccine development forward literally at warp speed. Top vaccine experts, who are usually sitting at the opposite side of the table from us, such as Paul Offit, Stanley Plotkin, and Peter Hotez, have all warned Congress and the public of the dangers of bringing a rushed vaccine to the market without necessary safety precautions, and which, due to the PrEP Act, have no liability. Vaccines that are approved under the emergency use authorization will not have gone through full scrutiny by the FDA. Furthermore, all the leaders in the COVID vaccine race are based on DNA or RNA vaccines, a methodology which has never been approved before in human vaccine development. Under the Federal PrEP Act, the vaccine manufacturers will have no liability for COVID vaccines. Similar to 1976 and 2009, millions will have been injected before a vaccine is pulled off the market if safety becomes an issue. Even if the vaccine is approved by the FDA, allowing pharmacists to administer vaccines that have not been recommended by ACIP leaves the decision of the appropriateness of the vaccine up to the pharmacist. On July 29th of this year, ACIP had emergency meetings specifically addressing the COVID-19 vaccine, and they said they would do so again once the COVID vaccine is approved by the FDA. Allowing pharmacists to administer vaccines that have emergency use authorization, no liability, and no ACIP recommendation is dangerous and should have stringent guidelines rather than the blanket authorization AB 1710 gives. AB 1710 has been rushed through the legislature, and for reasons stated, this bill is unnecessary and dangerous, and we ask respectfully for your no vote unless it is significantly amended today. Thank you.
Thank you very much.